Oh, definitely a pilot. Always wanted to fly, love travelling. Then I got told no one would get on my plane. So I'm Lucy Howe and I'm a dental I'm Lucy Howe and I'm a dental hygiene therapist. So you may have heard of a dental hygienist. So they're the ones who clean people's teeth. So you'll go to a dentist and then be told you need a scale and polish and you get sent to the hygienist. A therapist is similar to a dentist in the sense that they can do fillings. They can also treat children. But there's just a few things that they can't do that if you go on and become a dentist, that's when you progress to that next level. I was ideally wanting to go straight into hygiene therapy. It's a bit of a bizarre course that sometimes they have years that they want to take people straight on from college, and some years they want you to have a bit more experience. I finished college and with discussing with the unis that they decided just needed a bit more background within dentistry. So I actually went and did the certificate in dental nursing at Portsmouth University. So I did that for 15 months. Finishing that certificate in dental nursing, so you're able to apply for dental nursing jobs. I knew I wanted to progress onto hygiene therapy, so I didn't explore the options. But with that, you can go into do additional learning and go into different jobs within dental nursing, whether in practice or in community or hospitals. And I was fortunate enough, I applied straight to hygiene therapy and I got straight into hygiene therapy and started that a few months later. So in practice, it will be seeing patients when you go to a normal dental practice, just seeing people walking in from the street and just the general public. Community dental service is for people, they're referred from either dentists or sometimes GPs. So that will be children. So children are referred in if they're too anxious to be seen in the normal dental clinic, or they're requiring additional treatment, for example, treatment under general anaesthetics. They go to sleep in a hospital. But a note saying hygiene therapist, you can't do that. So that's the dentist who will treat children within the hospitals. You'll also see special care patients. So patients will be referred in again if they need additional care within the community service. Also complex medical history patients who are referred into. So any patients, basically, you go to the local dentist, and if they feel that you need a bit of extra care, you're referred to the community. Within hospitals, you get the different departments. You get the restorative department, paediatric department, orthodontic department, different departments. I work within the restorative department, and I'm in a bit of a niche area that it's only working with head and neck cancer patients. We just treat those patients before and after treatment. Key thing is you need to have people skills. You're working with patients, say 9 a.m. till 5 p.m, constantly having to talk to patients, constantly having to interact. So if you're someone that you just want to put headphones on and be at a desk, it's not the right type of job. You need to, even on down days or if you're not feeling very well, you've still got to be on top form and communicating with patients. And the other thing is manual dexterity. So the treatment's obviously very hands-on. So you need to have a certain level of manual dexterity. And I know in interviews, they quite like you to be able to demonstrate that. So good ones are musical instruments. I know one girl as a hobby did decorating cakes, which I know ironically for dentists is not with the sugar, but you've got to deliver. So sewing or anything like that are quite good suggestions for manual dexterity, and you've got to show that you've got a certain degree of manual dexterity. So a typical day for me would be very different for each day. So practice days, you'll say 30 minutes to 45 minutes appointments. doing that solely hygiene. Community days will be choosing a mix.